We know that weight gain can happen for many reasons, whether, chronic illness, certain medications, changes in hormones, pregnancy, menopause, many things can impact our bodies. Currently, our insurance plans here in the United States cover weight loss medications when you have a certain body mass index. So this is a measure comparing your height to your weight. So for patients who have a body mass index over 27, who have certain complications with their health that might include diabetes, elevated blood pressure, elevated cholesterol, or heart disease, you might qualify for weight loss medications. The other reason is if your BMI is over 30, that may directly also qualify you for weight loss medications. So it's really important that we eat a well-balanced diet. So trying to aim for at least 2 to 3 meals a day, small snacks, where every meal has some form of protein, and really trying to get adequate fruits and vegetables throughout the day. For many of my patients, we really want to make sure they're staying hydrated, especially in the winter months, so drinking a lot of water. Tea, coffee is fine, trying to avoid any extreme sugar containing beverages, juices, sodas, and alcohol in moderation. Movement is so important, and we actually do move more than we think. The current guidelines recommend engaging in activity for up to 30 minutes, 5 days a week, and trying to incorporate both forms of activity that get your heart rate up, as well as forms of exercise where you're trying to strengthen and tone your body. For many patients, it's helpful to keep a journal, tracking our foods throughout the day. There are many apps out there that you can use, whether it's Lose It, MyFitnessPal. It's also nice to also track your activity levels, wearing a Fitbit or tracking your steps on your phone, making sure you get adequate sleep, ideally targeting at least 6 to 8 hours a night, because we know when we don't sleep, it's also harder to maintain our focus and maintain some of these behaviors. It's really important to set sort of short-term, small goals that you can achieve, and then write them down and cross them out as you go. I think that helps.
The FDA-approved medications for chronic weight management can be used long-term. In fact, if you stop taking the medication, there is a risk of regaining the weight that you lost. If you're interested in stopping your weight management medication, make sure to talk with your weight management team to discuss the risk and benefits of continuing or stopping your weight management medication. Due to the high interest in medications for chronic weight management, there have been some shortages or challenges with the supply. Because of that, some pharmacies have begun creating their own versions of these medications, which we call compounded formulations. We do not recommend the use of compounded formulations because they're not approved to be safe or effective. Before using any compounded formulation of a weight management medication, reach out to your weight management team first. The role of the weight management team is to provide education, support, and monitoring. Education on weight management and medications used for weight management, supporting you along your journey and using medications, and monitoring your progress on your way to achieving your goal. One example of how your weight management team will help is to review your medication list to identify any medications that may be potentially increasing the risk of weight gain or making it harder for you to lose weight. Make sure to let your weight management team know of any upcoming procedures where you will have to stop taking your weight management medication. Your weight management team will help you with a plan to restart the medication following your procedure. As you lose weight, some other conditions may improve, conditions like diabetes or high blood pressure. Your weight management team will monitor those conditions and potentially make changes to some medications that you may be taking for those conditions as well. Your weight management team consists of multiple healthcare providers. Each team member provides a unique expertise to help and support you in your weight management journey. Take advantage of these resources so that you can help achieve your goals.
When you're prescribed a weight management medication by Mount Sinai providers, you have an option to get your medication from one of our Mount Sinai pharmacies. You can speak with one of our clinical pharmacists over the phone or video to learn more about your medication and the way it will help you lose weight. The clinical pharmacist can also enroll you into our pharmacy weight management program and closely follow up with you to help set and monitor your goals for healthy eating and physical activity.